Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering pharmacology, but to be more specific, I'm going to be covering the medications for BPH and kidney stones. If you haven't done so already, guys, please don't forget to like and subscribe below. Don't forget to check out my other social media platforms. My handle's the same across the board, Nexus Nursing. If you need some audio lessons or some resources, you can check out my website, nexusnursinginstitute.com. Okay, guys, without any further ado, let's get started. First question. The client diagnosed with mild BPH is prescribed 5-alpha reductase inhibitor Finasteride Proscar to relieve symptoms of urinary frequency. Which intervention should the clinic nurse implement? 1. Tell the client to drink at least 8 to 10 glasses of water a day. 2. Schedule an appointment with the doctor for a 1-week follow-up examination. 3. Have the laboratory draw a PSA antigen level. Or 4. Give the client a urinal to measure his daily output of urine. And guys, the correct answer is 3. Have the laboratory draw a PSA level, your prostate-specific antigen level. So guys, with this medication, the medication we're talking about, Proscar, it's supposed to decrease that PSA. If we see that's not going down, we see that's actually elevated, we need to assess that patient further. Maybe the patient has prostate cancer. Okay, 3 is the correct answer. Now let's look at our other choices. 1, tell the client to drink at least 8 to 10 glasses of water a day. Water has no effect on this medication because this is the medication that they're asking about. So that's not the correct answer. 2, schedule an appointment with the doctor for a 1-week follow-up examination. Excuse me. Well, here's the thing, guys. This medication takes about at least 6 months. Okay, 6 months for it actually to start working and for us to see therapeutic value. Okay, so 1 week is way too soon. Choice 4, give the client a urinal to measure his daily output of urine. That's not necessary. That's absolutely not necessary. The correct answer is make sure that we draw a prostate-specific antigen level. And what we want to see is that level go down. If it does not go down, we're going to be assessing this patient for possible prostate cancer. The client diagnosed with complaints of urinary frequency and nocturia tells the nurse he's taking the herbal supplement saw palmetto. By the way, guys, saw palmetto is on NCLEX. You need to know this. Which statement is the nurse's best response? 1, the use of saw palmetto is an old wives' tale. 2, this herb does help shrink the prostate tissue. 3, have you noticed any itching or rashes? Or 4, saw palmetto has been known to cause cancer. And guys, the correct answer is 2. This herb does help shrink the prostate tissue. We still don't know why. We don't know the mechanisms. We don't know why it happens. But what we do know it does work. It shrinks the tissue. Okay, so 2 is the correct answer. 1, use of saw palmetto is an old wives' tale. No, it's not. It actually shrinks the tissue. Choice 3, have you noticed any itching or rashes? That has nothing to do with that herb. So that's false. 4, saw palmetto has been known to cause cancer. That is false. It's actually a safe treatment for BPH. So the correct answer is choice number 2. The client diagnosed with moderate BPH is being treated with alpha-adrenergic agonist Tamsulosin Flomax. Which intervention should the nurse implement? 1, check the client's blood pressure. 2, send a urinalysis to the laboratory. 3, determine if the client has nocturia. Or 4, plan a scheduled voiding pattern. And guys, the correct answer is 1, check the client's blood pressure. So here's the thing. These BPH meds, they were originally made for hypertension. Okay, so a side effect of these meds are hypotension. No, let me back up, guys, because I said something wrong. They were originally made to treat hypertension. So what it does is bring down the blood pressure. So even though we're using this for BPH, a side effect is hypotension. hypotension. So whenever a patient's getting these medications for BPH, we need to be watching that blood pressure and making sure that that patient's not hypotensive, because what happens if they're hypotensive, they can get dizzy, they can fall, it's a safety issue. So number one's the correct answer. We're going to check their blood pressure because the side effect is that blood pressure going down, okay? Now let's look at our other choices. 2, send a urinalysis to the laboratory. Well, Flomax is for BPH. It's not for a UTI, so there's no need to send a urine to the lab. Choice 3, determine if the client has nocturia. Well, if they have BPH, a sign and symptom of BPH is nocturia. They're asking about the medication. Don't get sidetracked, guys. They're asking about the medication Flomax. So that's not the correct answer. Choice 4, plan a scheduled voiding pattern. Well, that would be great for a person that has incontinence, but we're talking about the medication Flomax. So you see how they kind of try to trick you guys? They kind of try to bring you off on the trail, but they're asking about the medication. So your answer has to be directly associated with the medication Flomax. And the only answer here is number 1, check the client's blood pressure, because we know a side effect of this medication is hypotension. The nurse is administering morning medications. Which combination of medications should the nurse question administering? Terazosin, Hytrin, an alpha adrenergic agonist, and captopril, Capitan, an ACE inhibitor. 2, Finasteride, Proscar, a 5-alpha reductase inhibitor, and digoxin, Lanoxin, a cardiac glycoside. 3, Tamsulosin, Flomax, an alpha adrenergic agonist, and metformin, glucophage, a biguanide. Or 4, Cerenova, Repin, saw palmetto, an herbal preparation, and metoprolol, Toprol XL, a beta blocker. And guys, the correct answer is 1. That Hytrin and the Capitan together, you're going to question that. Remember, I told you, whenever you get a test question asking you, which would you question? Which would you question further? Which would you clarify? Which would you call the doctor? All of those are questions saying which one is the wrong thing to do, which one's a wrong answer. And for these choices that's given to us, number 1 is wrong. And here's why. I want you to think about it. Hytrin, which is an alpha adrenergic agonist. Okay, this is the anti-BPH med. And captopril, an ACE inhibitor. What do ACE inhibitors do? Bring down the blood pressure. What did I tell you about those anti-BPH meds? What were they originally made to do? Bring down the blood pressure. So you're putting 2 meds together that will bring the patient's blood pressure down? You want to see that patient on the floor? Absolutely not. Are we going to administer this medication? No. We're going to hold those meds, call the doctor and say, hey, I noticed you ordered these 2 meds together. Are you sure? And the doctor say, oh, no, I was just joking. Here's what I want. And if that doctor says, yes, give it together, you tell that doctor, come down and give it yourself, because you're not doing it. Okay, so you're going to question that. These are 2 medications that will make that patient bottom out. Now, choices 2, 3, and 4, nothing's wrong. There's no concerns with these. So that's why we didn't choose them, because the question asked us which one would we question administering. And the correct answer is number 1. Which intervention is a priority for a pregnant nurse when administering, you could try to pronounce this med, guys, dutasteride, Avodart, to a client diagnosed with BPH? 1, use goggles for personal eye protection. 2, protect the nurse's oral mucosa from contact with liquid. 3, ask a male nurse to administer the medication. Or 4, wear gloves while administering the medication. And guys, the correct answer is 4, wear gloves while administering the medication. So that medication, Avodart, guys, that is a category X drug. That means that it's teratogenic. It can harm the fetus. So if the nurse is caring for this patient and she happens to be pregnant, she's going to put on gloves because she does not want that medication to seep through her skin and to get into her system. Because like I said, this is category X drug. All she has to do is put on gloves. Now let's look at the wrong answer choices. 1, use goggles for personal eye protection. This is a pill. Why would we use goggles? Remember, you put on goggles when you're expecting a splash to the eyes, right? This is a pill, so false. 2, protect the nurse's mucosa from contact with the liquid. Again, this is a pill. Why would the nurse's mucosa come in contact with that pill? False. Choice 3, ask a male nurse to administer the medication. Guys, if you've been following me for any amount of time, this is one of the things I always teach you. Don't pass the buck. This is your job, your responsibility, your patient. Just put on the proper PPE, which is gloves. You're going to give gloves. Even though it's oral, the reason you're putting on gloves is to protect you because you're pregnant, okay? The client diagnosed with BPH has had a TURP, transurethral resection of the prostate. The client is complaining of lower abdominal pain. Which intervention should the nurse implement? Rank in order of performance. 1, administer the prescribed morphine by slow IV push. 2, check the urinary catheter for drainage and clots. 3, determine if the client has a hard, rigid abdomen. 4, adjust the saline irrigation to flush the bladder. 5, dilute the morphine with several milliliters of normal saline. Okay, guys, we're going to put this in order, and I want you to keep in mind ADPI, assessment, diagnosis, planning, intervention, and evaluation. So the first thing we're going to do is number 2. We're going to do an assessment. We're going to check the urinary catheter for drainage and clots. Why? This is usually the main reason that the patient has pain. So that's what you're going to assess them for. That is the first thing that you're going to do. After that, number 2, the second thing you're going to do is our number 4. We're going to adjust the saline irrigation to flush the bladder. This is going to flush out any clots the patient may have. We want to flush out that bladder after we've assessed it, okay? Number 3, the next thing we're going to do is number 3. Determine if the client has a hard, rigid abdomen. Why? We want to make sure that the patient hasn't experienced any complications such as peritonitis, or what's that other word, the rupture? Perforation. Okay, those are complications that can happen. We want to make sure the patient hasn't experienced that. So that's number 3. And once we rule out those complications, then we'll do number 4, which is our number 5. We're going to dilute the morphine with several milliliters of normal saline. And let me explain to you why you do that. When you dilute it, it keeps those vessels from being irritating, because this med is very irritating. So you want to dilute it with normal saline before you actually give it. And last, we're going to do number 1. Administer the prescribed morphine by slow IV push. Everything led up to this moment. But before we were able to give that morphine by IV push very slowly, we had to assess the patient first. We had to assess them. We had to rule out any complications before we can prepare that morphine and finally give it, okay? Next question. The client diagnosed with BPH and congestive heart failure is receiving furosemide, Lasix, a loop diuretic daily. Which information provided by the unlicensed assistive personnel best indicates to the nurse that the medication is effective? 1, the UAP recorded the intake as 350 milliliters and the urine output as 450. 2, the UAP stated that the client ambulated to the bathroom without dyspnea. 3, the UAP emptied a moderate amount of urine from the bedside commode. Or 4, the UAP reports that the client lost 1 pound of weight from the day before. And guys, the correct answer is number 4. The UAP reports that the client lost 1 pound of weight from the day before. What is this weight you think the client lost? Fluid. Why is that important to us? Look at this diagnosis the patient has. Congestive heart failure. That patient's holding on to so much fluids that the heart's not functioning the way it's supposed to, because it has all this fluid that it has to pump out, right? So we're trying to get rid of fluids. That's why the patient's on the diuretic. So this is good news that the patient lost 1 pound of weight from the day before. Remember, guys, 1 kilogram is about 1,000 milliliters of fluid. So that is a lot of fluid that we were able to get rid of. That's a good thing. And something else, if you guys have been following my videos, I've said this many times, the best indicator of a patient's fluid status is not INO. It's not checking their skin turgor. It's daily weights, using the same scale, the same time of day, in the same type of clothes. That is the best indicator for us of the patient's fluid status, okay? Choices 1, 2, and 3, those are not the best indicators to us to let us know that this is actually working is choice number 4, and I already explained to you guys why. The client with renal calculi was prescribed allopurinol for uric acid stone calculi. Which medication teaching should the nurse discuss with the client? 1. Inform the client to report chills, fever, and muscle aches to the doctor. 2. Instruct the client to avoid driving or other activities that require alertness. 3. Tell the client that the medication must be taken on an empty stomach. Or 4. Explain the importance of not eating bread, cereals, and fruits. And guys, the correct answer is 1. Inform the client to report chills, fever, and muscle aches to the doctor. Why? These are adverse effects of that medication that we need to know about, and you need to teach that patient if you experience any of these to stop taking the medication and call us right away. Now let's look at the other choices. 2, instruct the client to avoid driving or other activities that require alertness. Allopurinol does not cause dizziness or drowsiness, so that's not necessary. 3, tell the client that the medication must be taken on an empty stomach. It doesn't have to be taken on an empty stomach. As a matter of fact, one of the signs and symptoms is GI upset. So you teach the patient, if they have any GI upset or irritation, to take that medication with food. Choice number 4, explain the importance of not eating breads, cereals, and fruits. Actually, those are the types of foods that that patient needs to be eating because they're low in purines. So guys, the correct answer is number 1. The client with renal calculi was prescribed allopurinol for uric acid stone calculi. Which statement would warrant intervention by the nurse? 1, I had to take 2 Tylenols because of my headache. 2, I drink at least 8 glasses of water a day. 3, my joints ache, so I take a couple of aspirins. Or 4, I do not drink wine or any type of alcoholic drinks. And the correct answer, guys, is 3. My joints ache, so I take a couple of aspirins. So for this patient that has a uric acid stones, they're taking allopurinol. Do we want that urine to be acidic? Absolutely not. We want it to be more alkalinic. And guess what? Aspirins are full of what? Salicylic acid, right? And it will make that urine more acidic. So that's a no-no. That's why that's the correct answer. Now let's look at our other choices. 1, tell the client to decrease the intake of fluids. No, they actually need to increase their intake of fluids. The last thing we want to happen is for that patient to get dehydration, to get dehydrated, right? Which would cause those stones to clump up even more. Choice number 2, I drink at least 8 glasses of, where was I? Did I miss my place? Oh, I'm sorry, guys. Choice 1 was I had to take 2 Tylenol because of my headache. Well, Tylenol is good. Nothing's wrong with that. And the reason, Tylenol doesn't make the urine acidic. So that's why that's a good choice. Choice 2, sorry guys, I was reading from another question. Choice 2, I drink at least 8 glasses of water a day. That's wonderful. We want them to do that. We don't want them to be dehydrated. And besides not causing dehydration, it causes lots of fluids. It flushes the kidney, flushes the bladder, and it causes those stones not to clump up. Choice 4, I do not drink wine or any type of alcoholic drinks. That's a good thing because we don't want anything with purines. No alcohol, no sardines, no organ meats, anything that is purines. We want this patient to be on a low purine diet. So choices 1, 2, and 4 are all good. Choice 3, that's the one that requires intervention. That's the one that you're going to question. That's the one that you're going to clarify with the doctor. Okay, when you see those type of things, that means which ones are the wrong answer. Does that make sense, guys? And I keep saying this to you because I see so many students, they read so fast and they don't understand when they see which would you question, which would you intervene, which would you clarify, which would you call the doctor. They don't understand that the test writer is really asking you which one's the wrong answer choice. That's the one that they want you to choose because they want to see if you understand that something's wrong in this situation. Okay, next question. Which intervention should the nurse discuss with the client who has calcium oxalate renal calculi and who has been prescribed a thiazide diuretic? 1, tell the client to decrease the intake of fluids. 2, explain the need to check the potassium level daily. 3, inform the client to check the blood pressure daily. Or 4, instruct the client to take the diuretic in the morning. And guys, the correct answer is 4. Teach them to take the diuretic in the morning. This is very important. Think about it. You're young, you're healthy. Even when you wake up in the middle of the night, you may be confused at first. So think about these elderly patients or these patients who have lots of comorbidities. If they're waking up in the middle of the night to urinate with that confusion, aren't they fall risks? Absolutely. Member safety. So we're going to give this to them in the morning so they urinate during the day, but they sleep at night. They're not getting up in the middle of the night to urinate. That's the correct answer choice. Now let's look at our other choices. 1, tell the client to decrease the intake of fluids. Absolutely not. Patient needs to drink lots of fluid, and I already explained to you why. Choice 2, explain the need to check potassium level daily. This patient's getting a thiazide diuretic. Now, if the patient was getting a Lasix, which is a potassium losing diuretic, then we'd be checking the potassium, right? Or if they were getting spironolactone, which is a potassium sparing diuretic, then we would be checking the potassium, right? If a patient gets a potassium sparing diuretic, that means they're holding on to the potassium could be high. If they get a potassium wasting diuretic, such as furosemide Lasix, it's going to make their potassium low. They could be hypokalemic. We're going to assess them. But this is a thiazide diuretic, so there's no need for them to check their potassium daily. So that's wrong. 3, inform the client to check blood pressure daily. Well, I love this choice because look how it tricked many of you guys. Right? Because usually when we give thiazide diuretics, we're giving it to what? Lower the blood pressure. Patient has high blood pressure. We give them a thiazide diuretic. They urinate all the fluid. Fluid goes down, and so does blood pressure. Blood pressure follows. But think about the situation, guys. Are we giving that thiazide diuretic to bring down the blood pressure? No. So when you're stuck between 3 and 4, you should have gone with 4 because of safety. 4 is the correct answer. You guys are going to start thinking like these test writers if it's the last thing I do. All right, next question. The client's admitted to the surgical department diagnosed with renal calculi. The doctor prescribed a morphine patient-controlled analgesia. Which intervention should the nurse implement? 1, instruct the client to push the control button as often as needed. 2, explain that the medication will ensure the client has no pain. 3, discuss that medication effectiveness is evaluated with the Wong-Baker FACES scale. Or 4, inform the client to ambulate very carefully to the bathroom and to strain urine. And guys, the correct answer is 1, instruct the patient to push the control button as often as needed. And here's why. That PCA only delivers a preset amount at preset intervals or time frames, which means if they reach their max within a certain amount of time, they can't overdose because it will only give what was ordered to give. Does that make sense? And with these PCAs, something else you need to teach a patient, they are the only ones who need to press that button. Nobody else, not family members. Here's why. I'll give you guys a perfect example. Patient sleeping, family members comes to see them, and the family member, excuse me guys, the family member noticed them groaning in their sleep, and the family member thinks to themselves, oh, well, he or she must be in pain. Boom, and they press the button. Guess what? If that patient was in pain and that pain was bad enough, they would have woke up from sleep to press the button themselves, right? We don't want them to cause a dependency issue. That's why only the patient should press the button. Because if they're in pain, that pain will be bad enough that they'll wake up and press the button themselves. So that's another teaching. Now let's look at the wrong answer choices, guys. 2, explain that the medication will ensure the client has no pain. Excuse me, what did I tell you about all inclusives? No, always, never, only. Do not choose that as an answer choice unless you know that's the answer, and this ain't the answer. No, guys, not no pain. You expect that pain to decrease. You expect that pain to be tolerable, but the patient is going to have pain, so that's wrong. Choice number 3, discuss that medication effectiveness is evaluated with the Wong-Baker FACES pain scale. What do we use this type of pain scale for? Children. Children who are unable to verbalize the type of pain or the level of pain, we use the FACES scale, right? So that's wrong. And choice 4, inform the client to ambulate very carefully. Stop. That patient has a PCA, you're going to teach them not to ambulate without assistance. If they need to go to the bathroom, they need to press the call button so you can come in and help them. Don't tell them to ambulate carefully. You're going to come and find that patient on the floor. You tell them to press the call button so you can help them walk to the bathroom if they have to go. The male client diagnosed with renal calculi is receiving pain medication via PCA pump. The doctor prescribed a non-steroidal anti-inflammatory drug, NSAID, indomethacin, in a rectal suppository. Which action should the nurse take? 1, question and clarify the prescription with the doctor. 2, give the suppository to the client and allow the client to insert it into the rectum. 3, administer a fleet enema to clear the bowel prior to administering the suppository. Or 4, have the client lie on the side and insert the rectal suppository with non-sterile gloves. And guys, the correct answer is 4. You're going to have them lie on the side and you're going to use non-sterile gloves and insert the suppository. Doctor ordered it, you're going to give it. There's nothing wrong with this. Now, let's look at the wrong answer choices. 1, question and clarify the prescription. There's nothing to clarify or question. There's nothing wrong with the prescription. 2, give the suppository to the client and allow them to insert into the rectum. Excuse me? Who's the nurse here? You're giving that medication. You don't pass the buck. You don't pass the buck to the patient. You don't pass the buck to coworkers. You do your job. So that's false. 3, administer a fleece enema. You don't have to administer a fleece enema. That bowel doesn't have to be cleared before you give the suppository. So guys, the correct answer is number 4. The client diagnosed with renal calculi is receiving pain medication via morphine PCA. The client is still voicing excruciating pain and is requesting something else. Which intervention should the nurse implement first? 1, administer the rescue dose of morphine via IV push. 2, check the client's urine for color, sediment, and output. 3, determine the last time the client received PCA morphine. Or 4, demonstrate how to perform guided imagery with the client. And the correct answer, remember ADPI guys, number 2, check the client's urine for color, sediment, and output. So the first thing we want to do, guys, is assess our patient. Patient before paperwork, patient before machine. Assess our patient, assess them for any complications, right? So that's the first thing we're going to do. Let's look at our wrong choices. 1, administer. So you're just going to go ahead and give that med and you didn't even check your patient. What if that patient had a perforation and you gave that med to cover up that pain that they were feeling, and that pain was actually the patient's body screaming, help, I need to go back to the OR. You have to assess your patient first. So number 1's wrong. Choice number 3, determine the last time the patient received PCA morphine. That's a great thing to do, but that's not the first thing that you're going to do. The first thing you're going to do is assess your patient. Make sure that there's no peritonitis. Make sure that there's no perforation. Make sure that there are no complications before you even check to see when's the last time that they got their dosage. 4, demonstrate how to perform guided imagery. Stop. Let me tell you something. If you've been following me for any amount of time, I've talked about this a million times. Pain never killed anyone except in a couple situations. Stones, like this, burns, myocardial infarction, or sickle cell crisis. In those 4 situations, pain can be so severe, it will interrupt the patient's physiological integrity. So guided imagery, that's not going to do anything for this type of pain. Stones, that's one of the worst pain a patient can ever experience in their life. So that is definitely wrong. Number 2 is a correct answer. The client with calcium renal calculi is prescribed cellulose sodium phosphate calcibine. The client asked the nurse, how will this medication help prevent my stones from coming back? Which statement is the nurse's best response? 1, calcibine reduces the uric acid level in your bloodstream and the uric acid excreted in your urine. 2, this medication will decrease calcium levels in the bloodstream by increasing calcium excretion in the urine. 3, it binds calcium from food in the intestines, reducing the amount absorbed in the circulation. Or 4, the medication will help alkalinize the urine, which reduces the amount of cysteine in the urine. And guys, the correct answer is 3. This is what calcibind does. It binds calcium from food in the intestine, reducing the amount absorbed in the circulation. So what happens is it pulls in the intestines, it binds it, then when the patient has a bowel movement, it all comes out in the feces. That's how it works. Now let's look at our wrong answer choices. 1, calcibind reduces uric acid level in your bloodstream and the uric acid excreted in your urine. We want to know what does that? Allopurinol. Allopurinol does that. Choice number 2, this medication will decrease calcium levels in the bloodstream by increasing calcium excretion in the urine. Thiazide diuretics does that. Thiazide diuretics. Choice 4, the medication will help alkalinize the urine, which reduces the amount of cysteine in the urine. Penicillamine does that. Not penicillin, penicillamine does that, okay? And we are down to our last question, and I'm actually running over time, but I still want to do this question, so let's go. The client diagnosed with rule-out renal calculi is scheduled for an IV dipielogram. Which action should the nurse implement? 1, keep the client NPO. 2, check the serum creatinine level. 3, assess for antibiotic allergy. Or 4, insert an 18-gauge angiocatheter. And guys, the correct answer is 2, check the serum creatinine level. Guys, this dye is very, very, very hard on the kidneys. So the first thing you're going to do is check the patient's kidney function. You're going to check the serum creatinine. Because if that serum creatinine is elevated, you're going to call the doctor. You're going to say, hey, I know you ordered this diagnostic test, but did you see that creatinine level? Okay. If the patient's kidney's in trouble, we are not going to give them this dye because it's enough to cause the kidney to shut down. Now let's look at our wrong answer choices. 1, keep the client NPO. Patient does not have to be NPO for this type of diagnostic test. And matter of fact, after they get this diagnostic test, we are going to flush them with lots of fluids. We want to flush this dye out of their body because of the harmful effects on the kidneys. Choice number 3, assess for antibiotic allergy. No, you actually want to assess for allergy to iodine. So you're going to ask the patient, do you have any allergies to iodine? Do you have any allergies to betadine? Do you have any allergies to shellfish, right? Choice number 4, insert an 18-gauge angiocatheter. We're not giving blood, guys. So you're going to give, for when it comes to this dye, you're going to give them about like a 20 or a 22, not an 18. So the correct answer for this was number 2, check the serum creatinine level. Okay, guys, I hope you found this video to be helpful. If you want to see more pharmacology, but maybe more pharmacology on a different subject, or you want to see me cover something altogether different, let me know and I will add it to my long list of content to cover. Don't forget, guys, to check out my other social media platforms such as TikTok, Instagram, Facebook. The handle's still the same, Nexus Nursing. If you'd like some resources, especially my audio lessons, you can find them on my website at nexusnursinginstitute.com. Thank you so much for watching this video, guys. Please don't forget, if you want to support my channel, share, and share. Share on your social media platforms. Share with your friends, anyone you know that's even thinking about the nursing program. Share. Once again, guys, thank you for watching the video, and you'll see me on the next video.